paper, totaling $30,000-$40,000 sometimes, and then just send them home to explain that to their spouse, it's a very inefficient way to do things. So from a business standpoint, 30 to 50% of these people end up moving forward with treatment. That's a failure. When you have 50 to 70% of people that pay money to come and see you for a consult, that they want your services, and then they go home and do nothing because they're confused. To me, that's a failure. It's failure to help people that really, really need it. And the three things that everybody wants to know, which are, how much is it going to cost? Who do I trust? What's the process? We make them jump through all of those hoops first before we answer those questions. So one of my favorite sayings is, confused consumers do nothing. If you are in the business of healthcare, but there's also a business component to it, which there isn't just about any side of healthcare. There's always the elective procedures that can be done within healthcare. Confused consumers do nothing. If patients don't know what's possible, or if they're confused about their options, most of the time they'll end up doing nothing. And so going back to what I mentioned before, this is true for every profession. Can you help me? What are my options? What is it going to cost? My challenge to you is to look at doing things a different way. Look at getting in front of people first, sharing with them who you are, what you do, a rough idea of what things could cost, then invite them to come in and see you. What happens then is, by the time they're actually there, trust has been built. They have an idea of what their options are. They have a ballpark on what their budget is. But this is a video that can be watched by a spouse, a parent, a grandparent, and you get total buy-in from those that are supporting and surrounding and helping your patients. Okay, most people don't make financial decisions alone. Most people make financial decisions with somebody else. So using video to get in front of those co-financial decision makers is important. And it's the way that you're going to be able to truly help more people. I don't want you to confuse this with, this isn't a conversation about money or sales. It's really just a conversation about communication. How do you get in front of more people to communicate what it is that your patients really need? Okay, so now using the Smile Virtual Platform, I can get in front of Alexa and say, hey, Alexa, I can help you. I know you've been to a few other consults and I know you're confused, but I have a solution for you. And I would love to share that with you. Here's what I'm thinking we could do. Here's some people just like you that went through the process that I was able to help. Here's roughly what it's going to cost. Here's the different ways to pay for it and to finance it. And here's the next steps to get started. So when you're ready, just know that I'm here for you. And the next step would be, come in, meet me in person, and we can go over things in more detail. Okay, see the difference there? One is somebody's coming into a consult appointment in your office completely blind. They don't know who you are. They don't know what you do. They have no idea what things cost. They have no idea what their options are. And so they end up most of the time doing nothing. Where now you can get in front of them and share all of that with them before they ever come in. So by the time they're actually in your chair, now you can have a real conversation about what you can do to help them out. So what's amazing for me to see is somebody that fought bulimia for 12 and a half years to now be in remission and be healed and have teeth that look amazing and have a smile that she absolutely loves. It's not about the teeth. It's not about how we did it. It's not about how many veneers or crowns were used to do it. It's about people. And you've heard me already say a few times, stop looking at it as procedures or patients. It's people. When you can really step up and help more people, you're going to win yourself too, both in business and in your professional success, as a healthcare professional. So it kind of breaks down to this. If you knew that if you did the same thing you're doing now, all your marketing efforts, instead of driving them to this old sales cycle and being very inefficient in how we communicate it, if you just send them first to a teledentistry consult, you're going to see that much more success. You're going to see 2 to 3 times the amount of success just by taking time, connecting, communicating with people, and serving them at the highest level. So we nowadays in healthcare, we are in competition for people's time. And we can reach significantly more people and serve significantly more people if we look for ways to save them time. Okay. This next section I call show, don't tell. And this is one that you'll understand more for those that get into dentistry, but it has to do with the traditional treatment planning process. Patient comes in wanting something to improve their smile, or wanting something to improve the overall health of their teeth. And we get into this mode of just clinical knowledge only, and logical treatment planning saying there's a cracked tooth, there's a broken tooth here, you need to do this. And we make down a list of procedures. And I believe in first showing people what's possible with their smile, and then talking about the details. Because once they see the benefit of them moving forward, once they see how it truly can help them, then you have plenty of time to figure out the details. But if you overwhelm them with details first, and it's all just logical knowledge where they don't ever get to really feel the benefit of working with you, it's different. And so here's something that I do that's called the Smile Test Drive. For those that get into dentistry and specifically cosmetic dentistry, is a fantastic tool of communicating with patients. This is Alexa. after she had that virtual consult, she was able to show it to her spouse, her parents or grandparents. They were able to put together enough funds for her to move forward and do treatment. And so the first thing that I did when she came in, instead of making it all about the procedures and making a list, I just asked her, hey, Alexa, would it be helpful if I took about 30 minutes and let you see what things are going to look like if we do work together? And then once we do that, then we can talk about the logistics and how we make that work. Okay, and so this is what the Smile Test Drive is. It's using a flowable composite resin to build up on top of the teeth and show her what her new smile could look like. It's a way to connect and communicate with people and show them the possibilities, then have a conversation about, the details and how it works and the timeline and all that good stuff. And so the lesson here is, emotional communication versus logical. Let's use a separate example, LASIK eye surgery. Let's say you get into ophthalmology, optometry, and you can talk all about doing the surgery and what it does to the retina and how it allows people to see better, or you can speak to, hey, what does that look like when you can wake up in the middle of the night and not have to put your glasses on? What does it look like to be able to get in front of a camera and smile and not be self-conscious of your glasses? Like, let's go through that first, and then once you see that, now let's talk about how the process works. So really connecting, communicating with people. Look at what can be done in 30 minutes. Okay, Alexa walks in like this, and within 30 minutes, I'm able to show her what that new smile could look like. Okay, check this out here. Now it's like she just watches her life transform right before her very eyes in 30 minutes of, hey, this is what things could look like if you decided you wanted to move forward with this procedure. Now we just got to figure out the details and figure out how to make it work. Okay, so always speak to the emotional benefit for the patient and not just the clinical benefit of what it's going to look like to work together. I'm going to go a little bit further within cosmetic dentistry. This is called prep for success. This is all in how we design the teeth when we do porcelain veneers. So this is maybe kind of crazy for you to see, but this is how the process works. Sometimes we can do it without having to prep away any tooth. People have really small teeth, they have spaces. We can go and put a porcelain veneer right over the front. Sometimes we need to take away a little bit more tooth to make room for that veneer. And sometimes we need to make spaces in between the teeth to get that veneer, that crown to fit on top of the tooth. And so porcelain veneers can be used for both cosmetic purposes and for health purposes, depending on what it is that the patient wants. And so this is a great example of somebody had some cavities between the teeth, discolored teeth over time, older crowns, just work that needed to be redone. But overall, she's got a great smile. There's not anything major that she needs to have done. But this allows us to go in and design the teeth now for these veneers that can go on top of the tooth, make things stronger in certain areas, fix any old cavities, and improve things from a cosmetic standpoint. Okay, that's what it looks like, kind of looking straight on. So this is a fairly conservative prep design where we're designing the teeth, but we're not having to go and grind away more tooth than necessary. Okay, once that part's done, then you are going to put them in a temporary to allow them to test out the new look and make sure they love it. So this is an example of old porcelain veneers that were taken off. We then raise the gum line a little bit and we put temporary veneers in place. When that's done, you can see as I toggle back and forth, the gum line's improved, the shape of the teeth is improved. They don't look so long. But when you look at it, you see still, it doesn't take a dentist to see this, but this tooth's a little bit wider than this one. There's still a little bit of a gap here. So there's things that still need to be changed. And so getting a photo of them in their temporaries on this next day is really helpful, because then I can take this and say, okay, we're close, but we need to open this up. We need to make things tighter. We need to make certain changes to their smile. And so once I have that photo, I can communicate it to my ceramist so that the final product looks better than the temporary design. Okay, so this is, from here to here, it's about a 1 week difference. And what happens is now as I'm making the final porcelain, I can say, okay, let's make this tooth a little bit wider. Let's close up these spaces. Let's get things to look as good as they possibly can. Okay, temporaries tell all. When designing a new smile, having a photo of the patient in their temporary veneers will give you a better view and a better idea of what the finals could look like. And so then when you go to choose the right material for patients, now you can choose something that's going to look good on them. E.max is a material that we use in dentistry that is really pretty, and it's going to be bright and it's going to be really strong. It has a little bit more lifelike look to it than, for example, something like Zircat Prime. Zircat Prime is super strong. You can run this stuff over with a Jeep and it's not going to break, but the trade-off is a little bit of aesthetic. See how this looks a little bit more opaque, a little bit brighter. In the E.max, you get a little bit more natural look, where in the Zircat Prime, you get strength, but now you also get something that doesn't look as natural. Okay, here's a great example of E.max in the wrong color, too much of a translucent porcelain. and replacing that with the same porcelain, just less translucent, it does a lot to the overall flow of the smile. So in the cosmetic dentistry space, it's all about listening to patients and what they want and helping give that to them. So hopefully you can see by now that really what I do in cosmetic dentistry is a lot more about meeting customer expectations, really figuring out what they want and then giving that to them. Also just making sure that all the work that we do is precise and it's accurate and it's as good as it can be so that it lasts a really, really long time. So I'm going to circle back now. We're going to kind of wrap things up with this idea of, okay, if we now know how to do better cosmetic dentistry, what can we do to create more trust and transparency with our patients? Social media is something that has completely changed all healthcare professions, in my opinion. And this is what we used to do in my office, is social media. It was more professional pictures, celebrating patients, team photos, just more of like feel good stuff, right? That's social media. Now, social proof is different. That's this idea of, hey, here's who I am as a dentist. Here's the kind of work that I do. And here's people that I treat just like you. That's social proof. You can see it across so many industries, in the hair industry, interior design, lip fillers, and injectables, microblading eyebrows. These are all social media. When it's used to show expertise or it's used to showcase the kind of work you can do, can be very, very powerful. Remember that first slide I showed you? What was that cycle? Attract. First, know how to attract more ideal patients by posting things on social media and having them see, okay, this is what he does. He's really good at this. You're going to get more and more people that reach out. When they do reach out, use video to record virtual consultations so they're more prepared when they come in and see you. When they actually do come in and see you, use that smile test drive to let them see what the smile is going to actually look like. And then when it comes time to do the work, really, really focus on doing a good job. So this methodology works. I've taken it and I've implemented it and mentored, hundreds of doctors all over the world on how to create your brand in a way so people see you as an expert in what you do. And I mean, first you need to be an expert. You need to do high quality work. But once you do that, once you have proof of that, then get out and share it with the world. My opinion is, it's almost like the best way to serve people without having to sell anything. It doesn't feel right sometimes to have to sell in healthcare. And so the best way to do that is just show people what you do. And when they do reach out, be willing to help them. Be willing to spend some time, even for free, and share with them what's possible. So when they do come in and see you, the trust is already there and they want to they want to move forward with treatment. They want to work with you. So the message I would end with is this: stop selling. Stop trying to convince people to buy things. Stop selling them treatments. This is healthcare. Just start serving them. Sometimes we think of serving in healthcare as doing free work or pro bono. No, it doesn't have to be that way. But you can do free work and give them 5 minutes of your time to say, hey, I'm Dr. Harris. Yes, I can help you. Here's what I've done for people just like you. Here's roughly how long it takes. Here's roughly what it costs. When you're ready, we're here for you. Until then, take care of yourself and just let us know if we can be of any help. That feels good to me. That feels like that's that's something I want to be a part of forever. Is just being there to help give people what they want. Not to try to upsell them on a crown or a filling or unnecessary dentistry because, we need to fill a quota for the day, or we need to get production on the books, or we need to, meet production goals. No, that doesn't feel right to me. I'd much rather just help people get what they want. And if you do that, the money will naturally follow, the success will follow. And so first, do no harm, right? First, take really good care of people. In my opinion, secondly, is just serve people at the highest level, help them see what's possible. Even if it means that they don't move forward and work with you, even being able to refer them to somebody else, like that stuff comes back around and it'll come back around and bless you in your life. What an amazing time to be a healthcare professional. What an awesome time to be getting into this field. I'm excited for each of you more than you know. I look back and I think it's one of the best decisions I ever made was going into healthcare. So as you move forward and as you get ready to start doing more of what it is you're studying to do, just always remember that it is a consumer-driven market. There was a time where patients would just come in as a doctor, you just tell them what they do and they do it. Well, now people are a lot more educated. They know what's possible. They know what's out there. They just want to make the right decision. So the more you serve them, the more you help them, the more you help communicate that to them, the more successful you're going to be. Okay, I hope that was helpful and at least allowing you to see a little bit about my profession and what I do. Best of luck to everybody watching this. Get out there, do good things, innovate, take good care of people. As you do, you're going to really learn to love your profession. And with that, I will leave you. Have a fantastic rest of the day and keep learning. Never stop learning. Thank you. Bye.
Okay, thank you so much everyone for watching our recorded shadowing session today. For those of you that have questions about the shadowing, you're still going to earn a full hour of shadowing for the day. That's because our guest speaker wasn't able to attend, so you're still going to get the full hour. If you want to attend our national session that's happening at 5 p.m. Eastern Standard Time and go and attend that session, maybe even just the first hour to get some live shadowing as well, because our guest speaker will be able to attend that session. You're more than welcome to. You will earn additional shadowing hours for that, but no worries. We're still going to give everyone full attendance for today. And we're not going to do a Zoom poll or anything. It's just going to be off of the attendance that Zoom automatically collects, just to be fair to everyone, especially since it wasn't a live video. But we still think that Dr. Brian Harris did a fantastic job explaining a little bit about his profession, and hopefully you all learned a little bit about cosmetic dentistry. And his social media was available during his during the presentation. So you can follow him on social media, see what he's been up to. He posts a lot about his career. And yeah, that is everything from us. So our shadowing will be done for the day. I know it's a little bit early, but no worries. Everyone's still going to get full credit for everything. And Ahmad is now going to take us and lead his workshop.
Yeah, guys, I am very excited today to do a workshop on public health and epidemiology. Just for some background, I am a public health major. I'm a senior public health major at UT Austin, and it's what I'm actually studying for my undergrad on a pre-med track. So I'm very, I've been very passionate about public health since around 10th, about when I was a sophomore in high school. And it was really driven by seeing a lot of disparities in my community, healthcare access, affordability, and healthcare for different minority groups. So when I was thinking of a major that I wanted to pursue in college, I wanted it to embody that. And I think one important takeaway that when I've sat on interviews that they've asked me is, why have you majored in public health? A lot of pre-health students typically focus more on the hard sciences, neuroscience, or biochemistry, or I've seen some computer science pre-health students. So typically students focus a lot on the harder sciences. However, the social sciences typically students might put a lot less emphasis on or see it as less important. And I hope today, after the workshop, that changes for you. And you can see some of the benefits of having an education in public health that allows you to have a global perspective and understanding of health disparities, as well as how people are able to understand how health impacts them and their community. So we'll take it from there. It's pretty interactive today. I focused instead of on definitions and teaching about the history of public health to teach you more about a work a public health practitioner would actually do. So some of the language I might use might not sound familiar, and that's okay. Feel free to use a chat to ask me questions. Let me know if anything is too difficult. I try to keep it at a level that is pretty understandable and for all levels. And if this is your, if you attended the summer camp last year, this is a completely different workshop. So you'll be learning a lot today. I have, I think the chat is disabled. We might keep it open just in case there's some interactive activities. Okay, sounds good. Thank you. So yeah, let's make one thing I request is let's please keep all questions till the end. However, there are a lot of interactives that you can participate in the chat. And if there's time for you to unmute, I will also allow you to do that. So we will go ahead and get started. Okay, can everyone share my screen? I will share these PowerPoints right after today's workshop. If everyone can see my screen, let me know. Okay, good. Okay, I will get started then. Okay. So Okay, so yeah, workshop agenda. Today, we're going to first talk about the multifaceted definition of public health, what it is. I first want to learn what public health means to you. Have you heard the term before? And then we're going to focus on explaining some health theory. Health theory is rooted in how we go about creating interventions. A lot of times people assume that public health programs are just designing programs without any sort of evidence-based measures, and that's completely not true. And you'll learn that today. And then the second is we're going to take some of the work that I hope you all are able to read, the case study that I sent from the CDC. Again, you don't have to read it. I just thought it would be really cool to read, to get to know about some of the work a field epidemiologist would do. And we'll discuss what that is, what that term means, and as well today. And then the goal is, at the end of the workshop, I want you to understand some of the role of theory and data interpretation in guiding public health programs and initiatives. So, what do you think of when you think of public health? What do you think of? Type in the chat. What are the words that come into mind? Feel free to use the chat to disease control, infectious disease. Yes, I love infectious diseases. Studying that is really disease prevention, healthcare for the community. COVID-19, yes, that was a really big public health crisis not too long ago. Herd immunity, correct. Developing immunity based on people taking vaccinations, for example. Health policy, data of public health. Yeah, exactly. Government intervention, disease control, awareness, and data. Yes, perfect, everyone. Unhealthy food. Yes, food interventions are something that public health practitioners focus on. Epidemics, endemics, all those immunity. Correct. Okay, great. You guys have some understanding of what public health is. That's exciting. Okay, so again, public health is an evidence-based science, and a lot of public health, there's multiple domains. So as someone wanting to go into public health, some people love the data side of public health. So public health informatics, epidemiology, study of disease distribution on different populations. Some people are focused on theory. How can we apply theory in real life to inform intervention development? Some people are very passionate about environmental health. Some people want to go and work in Congress or for legislation, to pass legislation. So they'd want to work in health policy. So public health is really for everyone. You can be on a pre-health track. You can be doing lab work in public health. You can go and be an advocate in community and serve as a lawyer in public health. There's really a very multifaceted career. Today, we're going to be focused on two elements of public health. It's going to be health theory. We're going to talk about what theory is and why it's important in guiding public health initiatives. And then we'll be doing some work as an epidemiologist. What does an epidemiologist actually do is what we're going to be focused on today. So I'm going to ground this in a study first. So a lot of what we're going to do today is, I don't want to give you definitions. I don't want to tell you what perceived severity in the health belief model, perceived susceptibility, perceived benefits. Like, these are very good things to know if you have an understanding of the definitions that can help guide when you're creating interventions. But I'm going to actually focus on providing some examples as well as the definitions alongside it, to hopefully allow you to kind of see what the work would be if you were working on theory in guiding interventions. So the public health topic of concern that we're going to be looking at today for the health theory aspect of this presentation is malaria. So malaria is a fly-borne virus that's transmitted in tropical and subtropical areas across the world. And it's specifically, a lot of the cases, about 94%, occur in Africa, with the global burden of disease especially present in Nigeria, Congo, Uganda, Ethiopia, and Mozambique. 95% of all deaths in 2023 were in the African region. So when public health practitioners are wanting to develop interventions, the first step isn't going to be, okay, let's go to Africa and let's go design some interventions. Let's go, give vaccinations, or let's go have spaces where people can get tents to cover up when they're sleeping to prevent bug bites. Like, that is not what the first step would be. First step would be trying to understand why there's such a distribution in Africa of this disease. That's the first step. So that's where you go and transition into theory. So instead of first going into developing interventions, you're going to first ground in theory. Now let's understand why this is as of concern in this area compared to other regions of the world. Yes, you all will get slides. All right, So you are a public health worker, and you are assigned to assess and understand the high incidence rate of malaria in an endemic region. So endemic region is a disease is controlled to a very specific area of the population. And high incidence is there's just a lot of cases. So incidence rate is something you see in public health work. Is what is the incidence rate? What is the rate of contact? How is the disease distributed in a specific population? How are cases compared to previous years? Public health is also surveillance. Surveillance is an important part of public health. Surveillance is when you are using data records to surveil a population for a specific disease. And this is what keeps public health practitioners informed about whether a disease is, if there's an outbreak, for example, you'll know because you'll see data compared to other time periods, and you'll see that it's unusual. So a lot of times when you go to the doctor, a lot of it's going to be informed on public health surveillance systems. Okay, health theory. This is the first part of today's workshop. And health theory are the conceptual frameworks that help understand, explain, and address health issues in different populations. It's a lot of work. So let's actually try and talk about what it actually is. So health theories are typically focused on the individual level and the interpersonal level. So why do people make the health decisions that they do? And the interpersonal level is how do social and external factors influence health decisions? So for instance, family members, friends, how are they impacting your health choices? Individual levels could be your own beliefs. Do you believe that the disease is severe? Do you believe there's benefits in taking all of those are focused on individuals. You'll have some theories focused on individual level and some focused on interpersonal level. Okay, there are tons of theories that you can study. And again, I didn't want to confuse anyone because it's probably some of y'all's first time learning about health theories. So we'll introduce two today. So the individual level theory we'll focus on is the health belief model, and the interpersonal level theory we'll focus on today is the social cognitive theory. So the health belief model is how do someone's personal beliefs about the risk and benefits of a specific disease or specific prevention affect their health choices. So the health belief model is can be very confusing because there's a lot of arrows, and it can we're gonna dive deep into each of what these actually means. So, for instance, the likelihood of someone engaging in a health promoting behavior is based on different factors. For instance, your perceived susceptibility. That is here. You can see that word right here, perceived susceptibility. And that is, do you think you are personally at risk of getting the disease? It's risk perception. For instance, in the case of malaria, this would be, I think my children are at risk of getting malaria because we live near swamps, and swamps are where a lot of incidence rates of malaria are higher. So that would be your perceived susceptibility. So do you think you are at risk? What is your risk perception? And then you have your perceived severity. And perceived severity is how do you believe of the consequences are serious? For instance, if you get malaria, do you think you're going to die? Or do you think you'll be okay? That's perceived severity. In COVID, for example, some people didn't want to wear masks. They didn't think that, the disease was, as deadly as it was, that's someone's individual perceived severity. The perceived benefits are the beliefs of the recommended actions. For instance, if you are using a mosquito net, and you believe that it's gonna help keep your family safe from getting bit by mosquitoes, that will be your perceived benefits. And then perceived barriers would be obstacles that make this behavior that you want to do difficult or less likely to occur. For instance, if there's not access to mosquito nets, or if you're not able to, leave an area where there's an endemic for malaria, you wouldn't be able to, you have that barrier. And then your self-efficacy is your own ability to take health action. So do you think you'll be able to actually do this intervention? And cues to action are typically like For instance, if you see a friend doing something, you'll be more likely to do something. So it's a cue to action. So, in insecticide treating beds is a malaria preventative method. And again, on the individual level, if you were to use these nets, what would be a potential barrier to access this net to prevent malaria? What would be if I wanted to ask you all in the chat, what would be a perceived barrier to accessing these nets? For instance, cost, exactly. If you can't afford it, or if it's not free in your community, that's one of the biggest barriers that prevent people to take health actions. It could also be community availability, community support, right? Those could be barriers. Inaccessible resources, great job, great work, yes. So that is individual level theory. So you're focused on your own beliefs, your own perceptions of disease risk to inform whether or not you'll take interventions. So yeah, that's the health belief model. And this is really important as public health practitioners, right? You want to understand others' severity, other barriers, other susceptibility of disease risk. Because if you were going to do an intervention and you wanted to, for instance, just provide a bunch of these bed nets without any context to a community, what if the community doesn't think the disease is severe? What if there are barriers to accessing such? Maybe there's cultural norms around the disease that you are not familiar with, So those are all, like, you have to understand that before you can develop an intervention. And as public health practitioners, the number one advice I've been given is never know that you know everything. Because if you're trying to go in a population and try to develop interventions, you need to work with the community members. This is the partnership. When you're working on interventions, do not seem like, if you're coming from the outside, that yes, you might know all the theory, you might know all the definitions, you might know all the how to do the data analysis and perform the analysis, but you can't do any any successful intervention without understanding the needs of the population that you're working with. I'm checking out the chat. Okay, no questions, we'll move. So that's the individual level theory. Now, the interpersonal level theory is emphasizing learning through observing others and social support. So if someone else is doing some sort of health behavior, how does it influence your own health action? So this is social cognitive theory. And so yeah, so the different kind of areas or the constructs behind social cognitive theory is, for instance, one example could be observational learning. For example, if children see their parents using these malaria nets, these insect nets, they will likely copy this behavior. So, people are watching others and learning from them. Reinforcements could be, for instance, what if family members were thanking other family or praising other family members of using these nets? So you're getting reinforced to do a health behavior. And again, also, this can also be rooted in self-efficacy. If you feel confident of your own ability to sleep at night when it's hot, hanging a net, that's another construct of the social cognitive theory. Another construct is reciprocal determinism. So for instance, it's reciprocal determinism is behavior that is shaped by a dynamic interaction between yourself, the environment, and the specific behavior. So this could be that if I started using a net in my community, if I started using a net, a malaria net to prevent malaria from getting bit by mosquitoes, my friends start doing it as well. So these are other people are influencing you to take this health action. So again, social cognitive theory is more about watching others, learning from others, observational learning, positive reinforcements that cue action and health behavior. Oh, okay. Yes, so I just touched on this, how bed nets for malaria prevention can be influenced by social cognitive theory based on you watching someone else do it and performing the behavior and it influencing your own actions. All right, the next kind of theory that we'll work on. So when we're trying to develop a public health intervention, you never start with intervention. I just discussed this a second ago. You want to first start with understanding the community, the factors that influence someone's ability to perform a health intervention. And one model that is commonly used is the precede proceed model. And this is a framework that is used kind of to plan and implement and evaluate public health programs. We'll focus today on more of like the precede section and step 6, which is the implementation. However, there's also the proceed section of this model, and that's focused on evaluating the intervention that you've done. And what this model helps public health practitioners do is to help identify the root causes of health problems and guide the development of targeted interventions. So you want to understand what a community needs, and to understand that you need to work with the community, and that is to understand all levels of you need to do an epidemiological assessment, a social assessment, and understanding factors such as the predisposing factors that reinforce health behaviors, or enabling factors that prevent a health action. So we'll talk about this kind of in depth in just a second here. Wait, can y'all hear me now? Okay, I think it worked. Okay. Yeah. Okay. So social assessment. So this is understanding the problem in the community. And it's, again, the main emphasis I want to reiterate here is you're utilizing the population as the main source of understanding the health problem. You are not the expert here. If you are going to a different country and trying to implement an intervention, you cannot go and acting like you are the expert. You are not. You're going to utilize the population to understand their needs. So this could be like, for instance, conducting a focus group or interviews with community members. You'll do a social assessment. And based on the social assessment is what will help you design and tailor your intervention. For instance, in the social assessment, you start seeing that specific segment of the population, for instance, pregnant women, they're more likely than any other part of the population to not use these nets. Then you'll design an intervention that's focused on helping pregnant women utilize nets when they're utilize these mosquito nets, So you're rooting your intervention in what the population needs, not what is needed in, for instance, or guided by literature, And then is the epidemiological assessment. So this is when you utilize clinical data and surveys to identify risks. So, and then this allows you, again, to reiterate, you can define the specific populations that you are targeting. And this, again, will help, this will kind of hopefully reiterate the need assessment that you performed and inform your final decision of what intervention is actually needed in the population. And then will be behavior and environmental risk factors. So for instance, what are the top 2 behaviors in a specific county, or 2 environmental problems contributing to malaria? So for instance, it could be not sleeping with these treated nets regularly, even if they're available. So a lot of times there might be already public health interventions put in place, but people choose not to do that. What theory can you use to understand someone's unwillingness to try to use a mosquito net, for example? What theory can we use? So this is understanding one's own belief about their ability to use a net to prevent malaria. What theory would you use? So we have either it's health behavior theory or social cognitive theory. So we're talking about someone's own ability to believe that they can successfully use one of these nets to prevent malaria. I see environmental health belief theory. Exactly. Health belief theory is exactly the correct answer. It's whether those specific constructs of the health belief theory can help inform your possible understanding of someone's behavior. And then another example could be improper net use. Maybe people are already having nets, however, they're not able to use them effectively, that they're only using them during rainy seasons when they think there's a higher chance of getting malaria. They're torn, they're not tucked in. This can all help understand your environmental and assess your environmental assessment. Another behavioral assessment could be that people are experiencing fever and malaria symptoms, however, they're delaying treatment. If you understand that, you can implement an intervention that's focused on early detection. And then the next factor would be the educational and ecological assessment, and that is right here. This is phase 4. So we talked about phase 1, learned about epidemiology, which is clinical data to inform your social assessment, and then behavior and environmental assessments, which is what we just talked about, someone's own behavior and their own ability to prevent disease or utilize a specific intervention, as well as the environment. See, these are all connected. And it all goes back to what? Phase 1, the social assessment. So now we're on phase 4, which is understanding the predisposing, reinforcing, and enabling factors. Now we're in phase 4. So these are the underlying factors that influence whether people are likely to adopt a health promoting behavior. And these are predisposing factors, and these are the internal motivations that make a person more or less likely to engage in a health behavior. So for instance, a predisposing factor can be there's limited understanding of how malaria spreads, or there's the belief that malaria is caused by bad luck or weather. Enabling factors could be that there are external conditions that either block or allow an individual from adopting a health behavior. For instance, there are few health workers in a city or in a county that help explain how to use a net, or there's financial barriers. So it's going to make it harder for you to actually go to a clinic if you are suspected that you have symptoms of malaria. And then reinforcing factors are what support or discourage behavior. And this could be like, for instance, social rewards, feedback, or influences that encourage or discourage behavior. This could be like community norms. If most of your neighbors aren't using nets, you might be inclined not to use a net either. If there's positive reinforcement, for instance, you're getting praised by a family member for using a net, that might further reinforce you to utilize and promote using nets to prevent malaria. Other reinforcing factors could be, and this is really important, this is one of the most important, is what tribal leaders, religious leaders, or government leaders, what their role in supporting the use of certain preventative methods could be. So, for instance, if you're religious and a lot of what you do is guided by religious beliefs, then you're more likely to listen to your priest or your imam to guide what you should do during outbreaks of malaria and whether or not you should use nets or not. So some interventions could be focused. You might see interventions directly even at these in churches, at mosques, at synagogues directly. Interventions can be there because a lot of people typically are guided by religious moral in the decision that they do. So those are the 3 factors of the educational and ecological assessment. And then administrative and policy assessment, and this is kind of assessing existing support or gaps in the healthcare system. For instance, if there are already nonprofits that are working with people and it's been successful, people are familiar with a nonprofit with providing a specific intervention, you might want to work directly with the nonprofit to guide your intervention or to implement your intervention, and might not start a whole new initiative in a community, because people are typically more likely to support organizations and listen to organizations that they have good reputation for. All right, so we're going to now do a practice scenario, and this hopefully will take some of what we learned today and apply it. Hopefully you all choose the right intervention when I give you the answer choices in a second. So back to the scenario at the beginning of the session today. You are a public health worker assigned to assess and understand the high incidence of malaria in an endemic region. And here's what you know. 2 in 5 households report at least one malaria case per month. Only 25% of families use bed nets. Clinics are understaffed and often lack the appropriate diagnostic capability to detect malaria. And many community members believe malaria is caused by cold weather or curses. So, to reiterate, so you're working in an endemic rural region, and a lot of people, the predisposing factor here, to tie into our assessment, is that many people don't believe malaria is life-threatening. They don't believe that you will die if you get malaria. So you've done a social assessment and you understood that these are one of the factors that is contributing to people not utilizing your intervention method or an intervention method such as net use. And however, you know that the community leaders or religious leaders have strong influence. They help reinforce health behaviors. However, after social assessment and you assessing the policy and administrative side of the PROCEED model, you see that they're not involved directly in malaria prevention. Now, based on what you understand about the PROCEED model, which of the following would be the most appropriate intervention? I want y'all to spend a few minutes thinking about this, and I actually want participants to participate. So feel free to raise your hand. I want this to be a discussion. And there can be more than one, there's one right answer. However, I want to hear what people are thinking and their thought process to the right answer. So I'll give everyone a minute to think about this. And let me know your answer choice that you choose. And I'll look at the chat. The question is here. So based on the PROCEED model and understanding the risk assessment that you've done, the social needs assessment, I mean, you realize that many people don't believe malaria is life-threatening, and community leaders have strong influence, but they're not involved in malaria prevention. So this is reinforcing people not to take prevention and action on using, for instance, these nets to prevent malaria transmission. All right, if I pronounce your name wrong, please let me know. Dajmadu? I'm so sorry, I know I butchered that completely.
It's all right. I think the answer it says train community leaders to promote correct bed net use and educate the public on the dangers of malaria. Because as in the assessment, it is believed that the population they listen a lot to their leaders and believe in their leaders. If their leaders tell them that it's not what you think malaria really kills, and to prevent malaria you need to do this. I think they'll listen.
I agree with their answer choice. Do we have any people that don't agree with their answer choice? So I see everyone collectively agrees on C, which is the correct answer. However, does anyone have a different answer that they would want to provide their own debate about? Does everyone collectively agree on C? C is the correct answer. Yes. So you'd want to train community leaders to promote correct bed net use and educate people on the public on the dangers of malaria. However, are the other interventions incorrect? So for instance, if you hadn't done the social needs assessment, if you hadn't understand the different factors, the promoting, the reinforcing and the enabling factors, and if you haven't tried to find why a certain community is not, a certain community member, certain community is not engaging in this behavior, you would have probably had so many different ideas of possible interventions. You could have been like, yeah, we can build more health clinics. But what health clinics would, yes, it might prevent a few cases. However, people listen to their community leaders. And if the community leaders aren't involved in the prevention, then you won't see any substantial decrease in the cases of malaria in this region. You can distribute bed nets to every house, right? You can for sure go to every house and give them the bed nets. However, does that mean that they're going to use it, or they're just going to put it to the side? What if they don't know how to use these bed nets? What if they don't believe in the bed nets preventing malaria? So yes, the other questions make sense of possible interventions and could be correct answers. However, in this scenario, we understand that people do not believe malaria is life-threatening disease. So if they don't believe it's a life-threatening disease, they're not going to use the bed nets that you distribute to the community. You don't know if people are actually listening to the radio because we didn't provide any we did not ask that question in our social needs assessment, right? So we don't know that would be effective. However, we do know that community leaders have a strong influence and they're not involved in malaria prevention. So here is where you'd want to use community leaders to bridge off of to promote and educate people on the dangers of malaria. Again, you're so right, Lana. All of these can be very important. And that's why public health practitioners focus on theory and focus on understanding a social needs assessment of a population before implementing a preventative method. Yes, all of these would be very great to utilize. However, if you're not listening to what the community needs and what the community believes, none of your interventions will work, Yes, you can, for instance, post flyers, for instance. However, what if people aren't reading the flyers or there's a language barrier? If you don't understand that, your intervention will not be successful, no matter how perfect your intervention is. You can have a very perfect intervention on paper. Like you can utilize all the theories in the world to guide a specific intervention. However, if it's not driven by what the community needs and what they're able to do, then you're not going to have a successful intervention. And that's the hard part of public health. Is like, yes, interventions are the easiest to do because all you got to do is collect a bunch of resources and implement it in a population. However, it's not going to lead to any substantial impact unless you understand the needs of a population. Does that make sense? So this was our kind of overview of health theory. There are so many health theories. I took a whole semester class on this, and I can tell you that there are so many health theories. However, we wanted to focus today on those two theories on guiding public health intervention. I'll take some time for questions here before we transition to the next part, which is going to be focused on epidemiology, and I'm very excited about this. If people are raising their hands, I'll just take a quick question before we move on. Parween?
Yes, I had a question.
Yes.
I really cannot really effectively know the difference between the individual level and the interpersonal level because I believe that the persons believe or because of their families and their communities believe. So I really am frustrated, like how could I distinguish between them?
I'll go back. Yeah, so individual is how do you make your own health decisions? And yeah, it can involve external sources, but it's how do you come up with your own health decisions? So how severe do you think, based on everything you know, based on all of the, for instance, based on what your family is telling you, how severe do you think a disease is? It's your own personal stance on their susceptibility and the severity of a disease and your own personal benefit. So do you believe that there's a risk? Do you believe there's a consequence if you do not take a health action? Do you believe in the recommended intervention or action to prevent disease? And then the social cognitive theory or the interpersonal level theories are more influenced on how do the social and external factors influence your health decision. So it's more about like learning through others. So if, for instance, you believe what you believe because you learned from your family that malaria is not, for example, a disease that you should worry about, for example, and then you don't need to take preventative methods against. So one's really focused on the social and external influences, and one's focused on individual level factors. These are hard to differentiate. If you start thinking about it, you're like, wait, don't these overlap? And yes, some of them overlap. But now imagine 5 theories under individual level, 5 theories under interpersonal level, and differentiating between all of them. That's tricky. That's why I said I wanted to keep this very like two theories today. However, yeah, that's a great question. Individual level, just think about your own beliefs an interpersonal level, think about how others are impacting your belief or what others are believing and how that's influencing your own health decision.
Yeah, thank you. I think I've got it. So thank you very much. And also thank you for the presentation. It's awesome.
Yes, perfect. Yes. Is there anything we can do personally if one of our family members has certain disease but don't want to take it? That's a really good question. So that is you could utilize so many different theories for that. But one thing is you could try to understand their own health belief. So for instance, you can ground it in the health belief model. You can try to understand why do they not want to take action? What is their own self-efficacy? For instance, if one of your family members has cardiovascular disease, right? That is it's a leading cause of non-infectious disease in the world. It's one of the most preventable diseases, yet the one that takes the most lives, and it's really sad. So for instance, someone's self-efficacy towards doing a preventative method in cardiovascular health, for example, running or eating healthy, could be one's own belief. Oh, I can't run, or I don't want to. For instance, a perceived barrier could be, for instance, I don't want to go to the gym because I'll probably be judged. Cues to action could be, for instance, if your friend is doing this health behavior. For instance, there's an app that compares. I know there's a lot of apps. Last year was very popular, like Step Up, I believe it's called, where you can compare the number of steps compared to your friends. So that can motivate you as a perceived benefit or a cue to action to taking some healthy interventions. And it's all focused on how severe someone thinks a disease is. And that's if you understand one's own threat of the disease, as well as the benefits and barriers for them to take health action, that could be a great way to help, help inform them to take some action. For instance, if they don't want to go on a walk because they don't want to go alone, maybe you can join them. Maybe that'll help alleviate some of that barrier. So again, that's how you can use health belief model in helping other people take necessary interventions. That's just one example. Again, there's so many I could provide. But again, focus on their cue to action. What is going to actually let them perform the health behavior effectively? And what are their benefits? What are their barriers? What is preventing them? For instance, a barrier for eating healthy could be that you don't have a nearby grocery store. You live in a food desert. A food desert is an area that doesn't have nutritious food, so you're eating out. And that's gonna increase the likelihood of certain diseases if you're not eating healthy, nutritious meals every day. So it's really rooted on this health belief model, and this can help guide someone's intervention or help guide someone to take intervention. I'm going to move on, and I'll take the rest of the questions. Feel free to just leave them in the chat, and as I see them, I want to continue to the next portion of our workshop today. All right. Epidemiology, I love epidemiology. I've taken multiple classes at the university level. It's one of my favorite subjects in public health. And epidemiology is the distribution of determinants and the control of diseases and other health-related events in populations. So I want you to imagine that you are a health officer working in a county. You've been hired by the CDC, and you are working in a county. And you get a call that there is a highly pathogenic avian influenza virus, HPA1H5 virus, that's been detected among dairy farm workers in the United States. This is transitioning again to some of the case study that I was working on. I did design this workshop for you. If you did not read it, you're okay. However, if you have read it and want to provide any insights, feel free to chat, and I'll take any questions. You get a call again. You're a health worker. You get a call about there's this pathogenic influenza virus that's been detected among dairy farm workers in the United States. And here's some context. So H5 viruses, HPA1, the avian virus, has circulated globally among animals since 1997 with sporadic human infections, mostly due to the exposure to infected poultry. In 2024, there's a specific clade of the virus that was detected in U.S. dairy cattle. This is a new animal reservoir. This hasn't been reported before. And in Texas, they're the first human case of an outbreak of HPA H5 virus in April 2024. And this caused public health workers to enhance surveillance. So surveillance, again, is just surveilling a population for a disease. So we're wanting to know if people are getting this disease, if it's circulating in the population. So the public health team decides to enhance surveillance. They decide to enhance surveillance. And one thing that you decide to enhance surveillance. Now it's time for you to understand what factors led to this disease outbreak. So yes, there's an outbreak in this population. What is the first step you do? In theory, it says we need to listen to the population. What is going on? Why are people getting this virus? That's exactly what you do in your field investigation. So once you've gathered all your resources, public health field epidemiologists are going to go to the specific population, and they're going to first interview. This is an interview that I designed for one of my classes, and I wanted to share with you because I thought there's some very important information. I'm going to actually pull it up now and share my screen, and show you how if you're this would be a real questionnaire that you could administer if you were to go to a specific population, this population with the H5 virus, and want to learn about the population. Again, remember the social needs assessment of the perceived model. Any intervention that you want to potentially do has to be guided by the social needs assessment of the population that you're working with. The public health practitioners quickly could have done some intervention. They could have provided thousands of vaccines, but that's not going to long-term prevent this disease. We need to understand exactly the cues to action, and that's going to be administered through a questionnaire. So let's share. I'm going to share my screen, and please let me know if my okay, I believe I can do that. Can everyone see my screen? Okay, I can see. Okay, so this could be a potential questionnaire that you can do. So first of all, you need to make sure when you're administering the interview that your instructions are clear. You want to make sure that there's no confusion. And that's why a lot of there's specific design, how we design questionnaires that are very important. And you probably can figure out as I read through some of these questions. So if you want to do a questionnaire, one of the questions could be, in the past 90 days, have you worked directly on a dairy farm with cow herds that had laboratory confirmed infection of bird flu? So this is actually the case definition. If you look in the actual document I sent, the case definition of cases that they are interested in is, in the past 90 days, working with dairy farm and cow herds that had a laboratory confirmed infection of bird flu, which is HPA1H5 virus. And you would want to ensure that, I want to make sure everyone can see my screen. I'm going through it. Okay, great. I'm going through the actual Google form, okay, that I created. Okay, so in the past, so the answer choice could be yes, no. For instance, you haven't worked, so this individual hasn't worked, they don't know, or yes, they have worked, or they're not sure. It's always important to use this not sure, because when you're using data, when you create this to a data sheet to analyze later, sometimes a person might not have, worked on a dairy farm and has no substantial evidence for you that's clinically significant. So you'd want to ensure you have language that ensures that if someone hasn't worked, or if they're not sure, that you can just end the interview there, and then you don't have to ask them any further questions. And one of the preventative aspects in this virus is refusing a seasonal vaccine. So for instance, you could ask them, have you received the vaccine? Yes or no? I don't remember. Decline to answer. And then you have all these different tasks that make you more susceptible to get the virus. For instance, what job tasks have you performed? You can ask them. Have they bred cows, fed cows, milked cows? You ask them this. And you don't make this a multiple choice question. You make this a check all. So for instance, as you say these different tasks, you're actually checking, okay, did they breed cows? No, yes, no, you keep going, and it's checkbox. And one of the flaws in even this intervention design that I noticed that when I designed this last semester is I didn't have any place for people to have like options like I don't remember or I'm not sure that I've bred cows. So a way to enhance even this form that I developed is to have those in place. So for instance, under breeding cows, you have a subsection of yes, I remember that I bred cows, or no, I don't remember, or I don't remember, or I'm not sure. That's kind of how you can improve this, even this form that I developed here. And then another question could be, after the cows became sick, did you use any personal protective equipment? And this can help you understand if people are actually taking the necessary precautions. And the next could be, besides cows, what other species have you had contact with? And again, you have a drop-down checkbox answer choice for this. All right, so now that you've collected all your data, you are now going to understand and interpret this data. So let me share my screen back to my PowerPoint presentation. Okay, one second. I'm gonna unshare. Here you go. Okay, let me know if everyone can see the screen. We're back at the PowerPoint presentation. Oh, and now you've got some data. You got seropositive and seronegative, which is pretty much seropositive is people that have actually developed antibodies for a specific disease and you found that they actually had this disease. And seronegative are people that don't have this disease. Now, the next thing you're going to do is you're going to actually put this data on a sheet. You're going to take, so for instance, in the interview, you found that 13 people were breeding cows. 25 people that were seropositive that had presence of this disease were changing or cleaning bedding. 13 were feeding cows, 100 were cleaning this milk powder. Then you're gonna actually go and create a Excel, or you're gonna go on Excel. I was gonna like live demonstrate how to create an Excel sheet, but I just felt that was gonna be too confusing. You can quickly look up a tutorial on how to take data and to create it into an actual data sheet, as well as how to create it into a graph that you can interpret. From this graph, I just want everyone to take a minute, read this graph, and tell me one of the risk factors, one of the specific behaviors or job tasks that were performed that increase someone's likelihood of developing serological evidence against serological evidence of this virus. So I want you to look at this graph. What can you read from here? What does this graph tell you? So now this is the data I collected in the field, and this data is exactly what you find in the actual article that I showed you all, that I shared with you all. This is where I took the data from, and now I want to actually create a visual representation. Exactly, yes, cleaning and milking the parlor. 100% of people that were cleaning and milking the parlor, the parlor were seropositive. So if we wanted to do an intervention based on this data, what intervention would you do? You would do intervention in working in the milk parlor and people that are cleaning their milk parlor and understanding exactly what they're doing that's impacting them or increasing the likelihood of getting the disease. So you could go back to questionnaire and talk to the specific, 100 people that were seropositive and ask them about their behavioral characteristics of working in these milk parlors so you can develop interventions. Also, you learn, I believe, in this study, it was reported that all of the people that were ill, that got disease, were Spanish speakers. So this could be a good time to do interventions that target the specific population. You also saw that all 8 that were seropositive or that developed illness, even if they were seropositive, all 8 did not use respiratory protection and only 3 used recommended eye protection. So you would want to understand, again, go back to health theory, health behavioral theory, health belief model. Why do they not think that they're susceptible to getting the disease? What are their cues to action? What are the perceived barriers for them to not use respiratory protection? First, this could be that it's too hot. It's too hot working in these fields that you don't want to use respiratory protection. This could be, and then maybe a public health intervention could be rooted in developing some sort of model or some sort of resources for people that allow them to utilize respiratory protection, but also take adequate breaks to be able to not get overwhelmed by heat, for example, could be one example. Exactly. Okay, so yeah, that is a role of a field epidemiologist. It's summarized in about 20 minutes. So it's not as in-depth. If you take a public health class, you can learn about the exact skills. For instance, you learn how to create these data sets. I spent a whole semester learning how to take data, create it into an effective data sheet, and create it into an effective visual representation. Now that you have all this, typically, if you're a field epidemiologist, which is a career you could look into, very fulfilling, it's really exciting. You would go to your health department and you do a situational report, and you'd explain to the people that you're presenting to about specific, you'd explain and give them a situational report of this outbreak. So yeah, that is one example of a role of field epidemiologists and how you can utilize real data to interpret and get public health conclusion. Again, it's all based on utilizing community members to give you the insights in the population to exactly what's happening. And it's not you thinking you're the expert and going into the field and developing your own intervention right away. That's not the most effective way to develop a successful intervention. So yeah, I will take some questions. I know this is a lot. I will share this slide. We'll ask our translation team to also translate this to any languages that you want to have access to with this information. So yeah, we'll do that. And I'll take some questions. I also believe that next week there'll be a mini workshop that Davina will let people know about. And so if you're interested in learning more about getting involved in public health, doing public health research, I don't mind sharing resources and how I've got involved in the field. This summer, I'm actually working on dengue virus, and I'm working on understanding transmission patterns of dengue virus in different areas in Africa. So a lot of what I'm using here is what's informing the studies that I do, and how I look at the data that I'm looking at, or how I interpret how I interpret possible future interventions. So all those skills are at the lab, actually. They're in the bench, so you're doing bench work. So I'm utilizing, for instance, qPCR and all these lab techniques to get data. However, it's all informing public health surveillance. And me having this background of understanding these different models helps me understand what could be a successful intervention in the future. So public health it's a very diverse field. There's so much we could talk. There's so much we could even cover more. But again, I wanted to make sure that we had a workshop that included two very important elements. So you guys weren't too overwhelmed with all the material. So yeah, I'll share some resources. Davina, I'll hand over the mic to you if you wanted to talk about the workshop. You wanted the mini workshop next week? We can also, Davina can also send information later on Slack. But yeah, I can be present for some time to help kind of give you all some opportunities that allowed me to get involved in public health work. But yeah, I'm very excited. I'm very passionate about this. So if you ever have any questions about public health, getting involved, as well as just ways that you can do public health work, please let me know. I'm always just a Slack message away. And this presentation will be shared. And we do not have a poll today. We're actually just doing Zoom attendance. So if you were here for the session, the majority of the session, we will count that as attendance. Again, we track all attendance. We have a Zoom that logs the attendance directly. So please, there's no poll. So no need to ask that question if you were wondering. We have no poll today. I'll take some questions and stick around. So I hope this was informative and helpful and spark some curiosity and some interest in the field. I think public health workers and people that are going into medicine with a public health background have so much compassion and so much critical thinking skills and cultural competence. And these are all skills that you need when you're a physician or you're going into the STEM field. Empathy is important, understanding how different populations perceive disease, and taking a step back and actually understanding that is very important in all your possible clinical diagnoses in the future. So I hope this was informative. And if we don't have any questions, we can end the workshop now. I believe Davina will send more resources on the mini workshop happening next week. And again, there's no poll, so stick around if you have any questions, and I will for sure provide any more additional resources for those interested in learning more about different theories. If you actually want to learn how I created this graph, feel free to message me on Slack. I can help kind of guide how I learned. This is not too hard to create, but there are very certain elements and how we ensure that so this data in this graph, you should be able to completely interpret without any data or any background present. I should be able to look at this graph, this graph, and be able to tell the whole story of what's going on. And that's what makes it hard, because not only do you have to have representative, subtitles and figure titles and legends, it all has to make sense to the audience that's reading it. And there's so many different types of graphs. There's histogram, pivot chart. There's a lot of different charts and tables that you can use. So yeah, this is just one example of the many different possible examples that you could utilize. There is no poll today, so we do not have any attendance polls today. We are taking Zoom attendance completely. We do not have a forum today. I'm repeating once again, we have no forum, no attendance. All the attendance is going to be taken through if you attended the Zoom today for the majority of the session. If you only attended for 20 minutes or 15 minutes, please message work or just re-attend today in the national session. We do expect that you attend the full session today. Yes, you can leave now if you are done with, you all are dismissed, if I hadn't said before. Yeah. And I'll stick around for some questions today. Yes, we do have a YouTube channel. You can check us out. If you check the itinerary, we'll actually leave the recording there today for this workshop, as well as the guest speaker presentation. And the CPR presentation is actually, yes, it's available. It's available on the itinerary if you check it out on our Notion page. If you entered 40 minutes late, I'd say that please just, if you were here for the majority of the session, I think you're okay. However, if there was a certain circumstance that prevented you from being here the full time, just send a quick message to Rorik. Please do not spam him though. He's getting a lot of messages, so please, he will respond to you as soon as he can. So yeah. And if you feel like you did not attend, if you know that you attend only 15 or 20 minutes of the session or not the majority of the workshop, we have the national session that you can join today as well. And our guest speaker, Zoe, will be there live today. I'm very excited for her speaker session today. There's no poll. Yeah, we'll be providing more theories and how can I know about more different models. I'll share some resources with you all. I'll put it on the itinerary and share some on Slack at the end of today where you can learn about the tons of theories that guide public health. There's no forum today. We know you attended based on Zoom attendance. So Zoom develops a sheet that shows us exactly who attended for how long. So make sure you have your full name that you use to join other sessions here today. Just to ensure that we can track your attendance. And there is no poll. I repeat it once again, there's no poll. No poll, there's no poll. We're taking Zoom attendance through a different way today. No poll, no Google form, none of that is for attendance today. We're not taking any of that. Yes, I can share more case studies. Actually, I can share more case studies. I'll provide another case study for you all to look at. Again, there will be resources. It will be shared on the resources on the itinerary this afternoon. Oh, that's okay. If you enter just a little bit late, like you all know best. Like if you know you did not learn like everything that you could possibly have learned today because you entered more than halfway late, like then again, that is you should attend the national session if you have the time today. Or if you if you have a drop in attendance because you all get one automatic drop in attendance to a session, you can utilize that. But I'll let you judge that if you believe that you got what you wanted out of this workshop and you were able to attend the full time. If 3 minutes is okay, if you disconnected for 3 minutes, we'll be able to tell that. if you want to benefit from the other speakers, yeah, feel free to attend the national session today. Yes, okay. I'll stick around for some questions. There's no polls again. So if someone's, if anyone's raising their hand and I'm not seeing, please let me know. Okay, here, okay. I don't think anyone's raised their hand yet, but if you want to ask any questions. I don't understand exactly. Is public health a specialty that only study cases or help people and participate in the process? So public health is actually can be a profession. You can explore public health work. You can work in a health department. You can work as an epidemiologist. You can work as a professor. There's so much you can do with public health. So it's a very multifaceted career. However, you can work, for instance, if you want to be an epidemiologist and actually work on cases and go and work on populations and do data analysis and work on in that way. And if you're more on the data side of public health, yeah, you can explore a field in like field epidemiology, for example. So there is a lot of different ways that you can get involved in public health work. So again, Myrna, I saw your question. Like I said before, we will know by Zoom attendance today. So there's no poll or Google form today. There is no poll or Google form today. And the session has ended. So if anyone has any questions, just let us know. Oh, okay, Davina, I saw some question. I believe I addressed that just like before I went out to the epidemiology section. But if there are students that are wanting to take action on family member addressing disease, I say go look back at health belief theory, health belief model, and understand how different factors such as perceived accessibility, cues to action, barriers are informing their beliefs on doing a specific health intervention. And if you have questions, feel free to DM me on Slack. I'm more than happy to provide some like language around that. I'm currently a biomedical engineering student and I have an interest. Yeah, so biomedical engineering is actually a really cool way of integrating public health. You can work on actually understanding the engineering side, but also you can be involved in public health. Feel free to send me a message on Slack. I'm more than welcome. I'm more than happy to look at some ways that you can get involved in public health. But public health can also be in the form of advocacy. So if you want to work on being an advocate in your community, you can utilize that as getting involved in public health. But feel free to message me on Slack and I can look for maybe specific opportunities for you that would utilize your engineering background and how that can benefit public health. Yeah, you can leave now if you are done. And there's no attendance poll again. There's no attendance poll, and if you can leave now, yes. I'll stay on for like 3 more minutes. So if anyone has questions pertaining to the workshop, please let us know. Or anything related to administrative questions, Davina is here also to address that. Okay, well, I don't see any questions. Feel free to message on Slack if there are any questions, though. I will respond as soon as I can, and I'm really excited. I hope everyone learned at least something about public health, something about utilizing it as a future career, or utilizing some elements to inform your own health decisions, or how you view health interventions in populations. That was the main goal for today, was to introduce just a little bit about what the fascinating field of public health is. Thank you all. Okay, I will go ahead and end the session. Feel free to reach out on Slack if anyone has any other questions. Yeah, and thank you all.